I was taking opioids for at least 8 years, and I probably saw maybe at least 5 doctors during that time. Then by the last year, which was the year 8, I was taking 14 a day. And yes, I have had difficult conversation with doctors about opioids before.
The topic of discussing an opioid use and the role of opioids in chronic non-cancer pain to be very challenging.
Even when they appear to be fairly simple, they can go in many directions, and it takes a lot of listening and skill.
If you challenge the patient too early or too aggressively or too blunt, then they will get defensive.
I really was going to the doctor for guidance and help, and I really often did not feel helped at all.
Motivational interviewing is probably the best evidenced communication technique for helping patients with chronic pain who are taking opioids to manage behavior change. The summary of the most recent meta-analysis was that for a small extra investment in time on the part of the clinician, you're going to see a 10 to 15% improvement in outcome. It's a very time efficient and effective way of helping patients to make change when they're stuck.
To build a relationship, you need to be flexible and recognise that it takes time. But I've found the discussion and learning about motivational interviewing has improved my practice because I can now go about it in a more systematic and considered way.
So the spirit of motivational interviewing is an ethos that the patient is the expert on themselves, and that communications with patients need to be done always in a respectful way. There are 4 main principles in the motivational interviewing approach, and the first one is expressing empathy. Expressing empathy is really the starting point. It's the fundamental element to motivational interviewing, where the healthcare provider really needs to convey to the patient that they understand the situation the patient's in. But the second principle of motivational interviewing is called developing discrepancy. And that's a technique whereby you, as a healthcare provider, help the patient to see that there's a difference between what they are telling you is important to them, and in terms of their values, in terms of how they want to live their life, in terms of what's important to their family and so on, and how they're actually living their life in the present. And it can be a bit of a light bulb moment to realize that, okay, it's about trying to get my pain under control, but it's really in conflict with the things that I think big picture are important to me in my life. Rolling with resistance is the idea that as a clinician, as a healthcare provider, we should never get into a confrontation with patients. Rolling with resistance is always about taking that step back and trying to re-engage with empathy, rather than get into a tussle with them about why they should be making this behavior change that you're sensing they're resistant to doing. One of the things that we know helps behavior change is patient confidence, is belief in themselves. So supporting self-efficacy is getting the patient to reflect on other parts of their life perhaps, or in relation perhaps to their pain, where they're actually doing things pretty well, giving the patient their own evidence that they have the capacity to make the changes that you're talking about with them. There are 5 main skills that underpin a motivational interviewing kind of approach, and the first one is open-ended questioning. Open-ended questions give the patient a chance to express their thoughts in a way that allows you to understand where they're thinking, where they're coming from in a more detailed sort of way. Affirmations are where, as a healthcare provider, you're listening for particular things that the patient's telling you that you can feed back to them, which affirms their capacity to change. So you're listening for evidence that the patient has in the past made change, or is interested in making change, or has some capacity to make change. And that's what you want to feed back to them, that you're hearing that there is a capacity here to do things differently. So you're affirming their ability to engage in this behavior change that you're talking about. So reflections are, again, part of careful listening, where you're feeding back to the patient something that they've just told you, which is important to demonstrate your empathy. So reflections are where you're putting into your own words some content that the patient's just told you, which allows them to understand that you've understood the situation that they're conveying to you. So summaries are sort of extensions or reflections. You're distilling what they've told you and putting it into your own words and feeding it back to them. And summaries can be some of the most effective ways of helping patients to feel that you understand what they're experiencing. You've synthesized it, you've put it into your own words and fed it back to them, which often makes patients feel, okay, this person really gets where I'm coming from. It can't just be about listening to the patient's scenario. At some point, you've got to hit them with some information, but trying to do it in a way of, what's your understanding, what's your reflection then, what are your thoughts about what I just told you? So you elicit their understanding first, you provide some particular information second, and then you elicit their understanding of your information, and particularly how's that maybe changed what they understood to be the case beforehand in a way that, again, engages the patient in this conversation rather than just telling them information or telling them what to do.
I think my key pieces of advice about the communication is knowing the patient, so understanding the patient and having an understanding of their journey to that point. The second bit of advice would be about taking time, so not expecting great gains quickly, but aiming towards building a therapeutic relationship over time. And with that, you build in the aspects of policy and behaviour expectations and potentially the contract about what you're willing to provide the patient, but what they're potentially going to gain from having a long-term relationship with the one prescriber or the one healthcare practitioner.
It is about asking open questions, letting the person talk, not interrupting, making them feel as if you're interested in them. So you're not looking at your computer, you're actually looking at the patient, you're giving them time, you're listening, you're reflecting back so that they know they've been heard.
The practitioner that I saw, she said, "Leah, I know you can do this, and I'm going to help you with this." And that was such an enormous relief. I finally felt like somebody was on my side. She helped me devise a tapering schedule, which was about 3 months long. And I think just her empathy, her honesty, her openness, and touching my hand, that made such a huge difference to me. The advice that I would first and foremost give to a doctor is, if you say, "How are you?" please listen to the answer. Really listen. Those ears are going to be some of your best tools